In this question, you have to point out the part of the nephron that is involved in active reabsorption of sodium. Option A, Bowman's capsule. It is incorrect because Bowman's capsule is involved in the filtration of blood from the glomerular filtrate. Option B, descending limb of loop of Henle. This is also incorrect because the descending limb of Henle's loop is mainly involved in the passive reabsorption of water and not sodium. Option C, distal convoluted tubule. Now, while distal convoluted tubule does actively reabsorb sodium, but its contribution is regulated by hormones like aldosterone, and it is also secondary to the proximal convoluted tubule in terms of the amount of sodium reabsorbed. Hence, it is incorrect. Option D, proximal convoluted tubule. The proximal convoluted tubule is the main site for active reabsorption of sodium because it absorbs approximately 65 to 70% of the filtered sodium along with water and other essential substances using active transport mechanisms. Hence, it is the correct option. In this question, you have to identify the correct statement. Option A, the descending limb of loop of Henle is impermeable to water. It is incorrect because the descending limb of the loop of Henle is highly permeable to water, allowing water to move out of the tubule into the surrounding medullary interstitium, thus concentrating the filtrate. Hence, it is incorrect. Option B, the ascending limb of loop of Henle is permeable to water. It is also incorrect because the ascending limb of loop of Henle is impermeable to water. Instead, it is permeable for sodium, potassium, chloride. Option C, the descending limb of loop of Henle is permeable to electrolytes. It is also incorrect because the descending limb is permeable to water and not electrolytes. Option D, the ascending limb of loop of Henle is impermeable to water. Now, this is true because this characteristic is crucial for creating or maintaining the concentration gradient in the medullary interstitium, which is much essential for urine concentration. Hence, it is the correct option. In this question, you have to match the items given under column 1 with those in column 2. Now, ultrafiltration refers to filtration of very fine particles having molecular weight less than 68,000 daltons through the Malpighian corpuscle. Thus, A matches with 4. Concentration of urine refers to water absorption from glomerular filtrate as a result of hyperosmolarity in the medulla created by a counter current mechanism in Henle's loop. Thus, B matches with 1. Now, urine is carried from kidney to bladder through ureter. Thus, C matches with 2. And urinary bladder is concerned with storage of urine. Thus, D matches with 3. Hence, the correct answer is option B. In this question, you have to match the items given in column 1 with those in column 2. Now, glycosuria denotes the presence of glucose in the urine, and this is observed when the blood glucose level rises above 180 mg per 100 ml of blood, and this is called renal threshold value for glucose. Thus, A matches with 4. Now, gout is due to deposition of uric acid crystal in the joint. Thus, B matches with 1. Renal calculi are precipitates of calcium phosphate produced in the pelvis of the kidney. Thus, C matches with 2. And glomerular nephritis is the inflammatory condition of the glomerulus which is characterized by proteinuria and hematuria. Thus, D matches with 3. Hence, the correct answer is option C. In this question, you have to identify the factors which is responsible for the formation of concentrated urine. Option A, low levels of anti-diuretic hormone, that is ADH. It is incorrect because low levels of ADH would lead to the production of dilute urine, as the main function of the ADH is water reabsorption in the kidney tubules. Option B, maintaining hyperosmolarity towards inner medullary interstitium in the kidneys. Now the kidneys concentrate urine by creating a hyperosmolar gradient in the medullary interstitium, and this gradient occurs or allows water to be reabsorbed from the filtrate from the nephric tubules, and it results in concentrated urine. And the high osmolarity is achieved by the counter current multiplier system in the loop of Henle in association with the vasa recta, and definitely in the presence of urea and NaCl in the inner medulla. Hence, it is the correct option. Option C, secretion of erythropoietin by the juxtaglomerular complex. It is incorrect because erythropoietin is a hormone which is responsible or is involved in the formation of RBC, but it does not play a direct role in urine concentration. Option D, hydrostatic pressure during glomerular filtration. It is also incorrect. Hydrostatic pressure in the glomerulus affects the initial filtration rate but does not directly determine the urine concentration. Urine concentration primarily depends on water reabsorption in response to osmolarity in the medulla, and also maybe by the action of the ADH. In this question, you have to choose the option that represents the outcome of using artificial kidney during hemodialysis. Now, statement A, nitrogenous waste buildup in the body. This is not true. The purpose of hemodialysis is to remove nitrogenous wastes such as urea and creatinine from the blood. Therefore, using an artificial kidney during hemodialysis would not lead to the buildup of these wastes. Instead, it would help eliminate them. Statement B, non-elimination of excess potassium ions. This is also not true. Hemodialysis effectively removes excess potassium ions from the blood. So the use of an artificial kidney would not result in the non-elimination of potassium. Statement C, reduced absorption of calcium ions from the gastrointestinal tract. Now, it is true because hemodialysis can lead to disturbances in calcium and phosphate metabolism. The kidneys help in the activation of vitamin D, which is necessary for calcium absorption from the gastrointestinal tract. So, if the kidneys are not functioning properly and hemodialysis is used, calcium absorption can be reduced. Statement D, reduced RBC production. This is also true because the kidneys produce the hormone erythropoietin that stimulates the formation of red blood cells. So, in patients with kidney failure, erythropoietin production is often decreased. Hence, the correct answer is option C because it includes that statement C and D, both of which are correct.